Envision a world where compassion and science converge, a world where the healing touch and a caring heart are as crucial as medical acumen. This is the quintessence of nursing, a venerable vocation that has transformed from its modest origins into a cornerstone of contemporary healthcare. Nursing today transcends a mere job. It is a multifaceted pledge to aid those in need. It's a harmony of art and science, a legacy of care dating back to ancient civilizations that now encompasses roles pivotal in reshaping patient care. The emblematic figures of history and the dynamic nurses of today have tirelessly advocated for patients' wellness. Present-day nurses serve as educators, leaders, and ethical advocates, fortifying the healthcare infrastructure. They introduce unique competencies, creating an atmosphere where every person is valued and every action can create significant change. Let's delve deeper into how nurses not only deliver care, but refine it, embracing challenges and perpetually redefining healthcare's future. At healthcare's core, within its lively halls and during quiet bedside moments, stand the nurses, our central caregivers. They meet patients at their most vulnerable, delivering care that surpasses medicinal remedies alone. Theirs is a care that is tender, a compassionate presence that speaks volumes without a word. On the front lines, nurses pair clinical expertise with genuine supportive connections, embodying the marriage of science with the soul. Their commitment to excellence in care is the thread that binds the patient experience. In the unwritten chronicles of nurses' lives, they encounter the breadth of human emotion with enduring commitment. As custodians of comfort, their influence on patient well-being is profound. We now turn our focus to the enlightening aspect of nursing, where these sentinels of health transition into ambassadors of knowledge, guiding patients towards conscious health choices. As beacons within healthcare's expanse, nurses do more than provide. They enlighten, offering wisdom as critical as any therapeutic intervention. Their educational role empowers, igniting the passage from illness back to health, nurturing patients with knowledge to manage their well-being effectively. Nurses tirelessly expand their expertise to serve both individuals and the community better. They convert complex medical language into understandable advice, fostering intelligent choices that echo through generations. As we've appreciated their compassionate care, we now recognize the transformative power of their educational mission. Each insight shared by these unsung educators propels us toward a healthier future, reinforcing that their influence extends beyond warm gestures and into the realm of ethical advocacy. Witness next how nurses, as moral custodians, weave integrity into healthcare's tapestry, advocating for justice and ethical practices within the medical profession. Amid healthcare's intricacies, nurses stand as unwavering champions for their patients, navigating the nuanced intersection of individual rights and medical ethics. Their role in policy development is invaluable, bringing lived experiences and compassionate insight to the forefront of healthcare legislation. Their advocacy resonates beyond patient interactions, influencing a just and equal healthcare system. With nurses' integral contributions, ethics become foundational to policymaking, ensuring dignity and engendering trust. Their leadership in these domains paves the way for more compassionate care management. Join us as we examine how nurses enact leadership, directing teams with ethical precision and solidifying their impact on health and wellness. In the orchestra of healthcare, nurses often assume the role of maestro, leading with insight and empathy. Leadership for them is a natural extension of their calling, directing the ensemble of healthcare where each member contributes to the harmony of patient care. Imagine a ward where every resource is meticulously managed. Here, nurse leaders ensure the delivery of personalized care. They adopt roles from mentors to administrators, each exemplifying leadership that enlightens and guides. Their leadership acumen lies in balancing grand vision with attention to detail and navigating team dynamics while sustaining the rhythm of patient care. With a focus on nurses' influential roles, we must acknowledge the responsibility that accompanies their leadership, the duty to mentor, energize, and nurture. Looking ahead, witness how these stewards of care translate leadership into outcomes that reverberate beyond the clinical environment, molding the patient journey. Amidst the tempestuous world of healthcare, nurses stand resilient, The challenges they face act as forges, tempering their strength and nurturing their resolve. Their path, chosen willingly, is lined with emotions as they immerse themselves in human suffering and triumph. This emotional landscape, while daunting, illuminates their tenacity, providing a beacon for those in their care. It is through overcoming adversities that nurses exemplify the indomitable spirit of their profession. Their grace under pressure unites them, weaving a bond of solidarity that sustains both patients and peers. As we press on, we acknowledge the heroism of nurses, whose courage and compassion rewrite the narrative of healthcare. Their story, marked by relentless bravery, shapes the landscape they serve with every act of care, every life embraced. Beyond the confines of medical facilities, nursing's influence radiates, impacting care quality, patient satisfaction, and the evolution of healthcare. As agents of change, nurses contribute critical thinking and compassion, driving standards upward and outcomes forward. Their subtle kindness and informed advocacy are keystones to patient contentment and recovery. By leading innovations and integrating best practices, they revolutionize care delivery and prompt healthcare improvements. Every shift sees them building healing environments that ripple outwards, affecting national healthcare progresses. Balancing technical skill with heartfelt care, they define a distinctive role within the healthcare tapestry. As we approach our journey's zenith, let us celebrate the spirit of nurses and their invaluable contribution to shaping our world's health. As our exploration nears its end, we honor the valor and adaptability exhibited by the nursing community. These sentinels merge proficiency with empathy, forming the foundation of healthcare. Across all roles, be it caretaker, educator, advocate, or leader, they propel the journey toward improved health and well-being. Their hands not only facilitate healing, but also carry the beacon of knowledge that lights the path for healthier living. They assert themselves as voices of advocacy, calling for the maintenance of ethical standards. With courage and competence, they guide us, crafting indelible pathways to superior patient care. These challenges they face, while immense, become catalysts for their exemplary resilience, a beacon that instills hope and instigates action. The imprint they leave is indelible, echoing their undying commitment to every individual's welfare. As we close this chapter, we are called to support, celebrate, and possibly join the nursing ranks, collectively ensuring that nursing's legacy remains one of humanity's crowning achievements.